Prostate cancer begins with just a few cells inside the prostate that lose their natural control. Normally, cells grow, divide, and die in an orderly cycle, but cancer cells ignore these rules. They start dividing when they shouldn't, and they just keep dividing. Over time, these abnormal cells pile up, forming a small cluster. This is the beginning of a tumor. At first, this growing mass of cells is still confined within the prostate. But as it expands, the tumor begins to build a network of blood vessels around itself to make sure it gets enough nutrients to grow quickly. These new blood vessels don't just feed the tumor. They also create an open pathway for cancer cells to escape. Some of these cells can break off and enter the bloodstream. These cells may float silently for a while until they find a place to exit the vessel, settle down, and begin forming a new tumor. It often reaches nearby lymph nodes first, but over time, it can reach the lungs, as well as the bones or other organs. As the cancer grows, it can start to press on the urethra, the narrow tube that carries urine from the bladder out of the body. When this happens, symptoms might start. Before urinating, there might be difficulty getting started. During urination, the stream may be weak or interrupted, as if something is squeezing the flow from the inside. And after urinating, there can be a lingering sensation that the bladder isn't fully empty, leaving you with the constant feeling of needing to go again. Because prostate cancer often grows silently in the early stages, around 90% of cases are detected through screening rather than because of symptoms. The first step is usually a PSA blood test. PSA stands for prostate-specific antigen, a protein made by normal and cancerous cells in the prostate. It's normal for men to have some PSA in their blood, but when levels are higher than expected, it can be a sign that something's going on. Alongside the PSA test, doctors may perform a digital rectal exam. During the exam, the doctor gently inserts a gloved, lubricated finger into the rectum to feel the back of the prostate. An elevated PSA or an unusual rectal exam doesn't always mean cancer. To know for sure, doctors need to look directly at the prostate tissue. This is done with a biopsy. During a biopsy, small samples of tissue are taken from different areas of the prostate using a thin needle. These samples are then examined under a microscope. Once cancer is confirmed, doctors use imaging tests to see whether it's still confined to the prostate or if it has spread to nearby lymph nodes or bones. This helps guide treatment decisions. If you want to see how we actually interpret these scans, I've made a 2-part video series on how to read a CT scan. Feel free to check it out if you're interested. In localized prostate cancer, the tumor is still inside the prostate and often grows very slowly. This is why doctors may recommend active surveillance, regular checkups to watch the cancer closely. But if the cancer becomes more aggressive, then it's time to act. The most common treatment at this stage is surgery to remove the whole prostate. If the cancer is still contained, that surgery can be curative, meaning the patient is cancer-free. However, sometimes a few cancer cells manage to stick around and spread to other parts of the body, where they start to grow again. That's when the cancer is considered metastatic. At this stage, surgery isn't an option anymore. You can't possibly cut out every tumor cell in the body. That's why doctors turn to chemotherapy or androgen deprivation therapy. Prostate cancer uses testosterone as fuel to grow, so the goal is to shut off that fuel supply. This is done by giving drugs that block the body from producing testosterone. When testosterone levels drop, the tumor usually shrinks. But here's the catch. Prostate cancer is clever. Over time, it learns how to grow even without testosterone. That's when we enter a new phase called castration-resistant prostate cancer. Doctors may use stronger hormone-blocking drugs, chemotherapy, or lutetium therapy to try to slow it down. The focus becomes managing the disease for as long as possible. On average, survival ranges from 13 to 23 months. Thanks for watching. If you'd like to learn more about the human body, feel free to check out my other videos.